Thanks everyone for tuning in to today's webinar on the benefits and challenges of cloud connectivity in digital healthcare. In our discussion today, we're going to talk about the benefits of cloud connectivity and how to manage the challenges like security, privacy, cost, and time for a successful outcome. Our featured speaker is Abbas Dhilawala. He has over 15 years of experience developing enterprise-grade software for medical device industry. He's well-versed with the technology and industry standards regulating security and privacy of data. His expertise lies in programming, cloud, cybersecurity, data storage, and regulated medical device software. Before I hand it over to him, I just want to remind everybody that you're welcome to drop in questions at any time throughout the presentation. You have a little questions tab over on your panel. We will get to all of the questions at the very end, so just hang tight. And also, today's presentation is live recorded, so we will post it on our YouTube channel later this week, so you can always go back and rewatch it. But with all that being said, I'm going to go ahead and let you take it over.
Thank you, and thanks all for coming. Can you guys hear me all right? There's some echo I hear.
You sound good on our end.
Okay, good. That's all matters. So thank you again for taking the time. We'll talk about some of the benefits of cloud connectivity and digital healthcare, and then the challenges that come with it and how to address those challenges. So I'm going to start with some basic challenges in healthcare industry in general. Most of this is well known in the society, but one of the ones we are at least facing here in the United States is the graying, what we call the graying of America. So as we go older, more and more baby boomers are retiring. There's an average of about 10,000 baby boomers that retire every day. With that comes healthcare challenges. As you grow older, you generally have more healthcare problems. And as you have a big swath of people retiring and putting pressure on that healthcare system, there is needs for solutions, for innovations that can address some of that problem. The other problem we have is the rise of chronic diseases, so like heart disease, cancer, and there is, as of today, 6 in 10 adults in the US have a chronic disease. So that's a pretty high rate. But by some estimates, it's going to be about half the US population that has at least one chronic disease by 2025. So managing chronic diseases, those are generally very costly. Most of these are lifetime problems that take a lot of resources in terms of healthcare. And so how do you address those? What are the innovations that will address those challenges that we have? And we'll look at some of those right now. The other problem, as we are more global society, trade and travel has increased the flow of diseases also. Diseases used to be, 70, 80 years ago, kind of be mostly confined to a geographic location. That's not the case anymore, and we saw that in the last 5 or 6 years, with Zika and Ebola and SARS and other kinds of deadly viruses and diseases around that. So managing healthcare systems are designed to be local, they're designed to be isolated, but when you have diseases that flow over jurisdictions, how do you manage? What are the a lot of problems there? How do you address those in terms of tracking people, in terms of understanding where the hotspots are, managing resources so resources can be deployed? So a lot of challenges around kind of global pandemics as well. The other problem, as we all know, is the increasing cost. This just shows how costs have increased. These are only Medicare and Medicaid data, but the private insurance market has seen pretty much the same increases in the last 50 or so years, and it's going to project it to keep going up. So when about 10%, roughly 8% of GDP is going to be addressed to just Medicare and Medicaid expenses, that's a pretty big burden on any country. So again, there is a lot of opportunities there to kind of reduce that cost, and digital health in general we see as playing a fundamental role in trying to address all of these challenges. Some of the things that have happened in the last 10 years while we have all these challenges is technological advances. For one example, 11 years ago the iPhone was released. that put a lot of power in people's hand. A smartphone of today is about 1,000 times more powerful than the computers that put man on the moon. So we have a lot of power at our fingertips or in our pockets. Those can be utilized. That power can be utilized to deliver healthcare in very different ways, and we'll see some of the examples later on. The other thing that has happened is this idea of what we call Internet of Things. So basically, all things that are connected to the internet. Internet connectivity is becoming more and more common. It's also becoming more accepted. Smart speakers, for example, a lot of challenges there, but smart speakers are becoming one of the hottest trends, at least in the United States and also globally. So connected things, whether it be your microwaves, your refrigerators, or your devices, is something that's on the rise across different industries, but specifically healthcare and pharmaceutical kind of industry. We see a lot of connected opportunities that are in proof of concept or close to deployment. Another thing that has happened over the last 10 years is the availability of what we call cloud infrastructures. So basically, server resources or computing capacity that's available at mass at a very cheap price. So very inexpensive infrastructure that can be leased, for which you don't have to have a long-term, you don't have to buy computers and buy all this infrastructure. You can just lease it at a very inexpensive rate. That allows you to get a lot of computing power to do a lot of things that were harder or almost impossible 15, 20 years ago, like crunch through a large number of data sets, look at patterns or find patterns, and use shared resources to kind of lower that cost to do all that stuff. And then the last thing that has happened, nothing new, but has taken a pretty upsweep recently is the whole concept of artificial intelligence and machine learning. A lot of other industries have been much more advanced than healthcare, but healthcare is catching up. There is a study from Accenture that says, healthcare investments in kind of AI and machine learning in general is going to go up to 40% year over year until 2021 from 2014. So a big jump in what a lot of startups are trying to do is use artificial intelligence and machine learning to solve a lot of these problems. And we'll look at what are these available. So keeping two things in mind, the challenges we have in healthcare and then the technological advances that we have achieved in the last 10 years opens up a lot of opportunities for medical device companies to innovate in different forms. And some of the opportunities are, reducing healthcare costs. So delivering healthcare in a very different way to not have a traditional healthcare model. Also looking at ways to know kind of some of the inflection points in healthcare and how to predict those inflection points or how to get ahead of those inflection points. New delivery models. So instead of traditional delivery models, go to a clinic, go to a hospital, see a doctor, wait for healthcare to be given to you, more proactive, more distributed healthcare delivery models. Those are opportunities. Reimbursement. So while all this happens, there's also an opportunity to increase your coverage as a company, because that's ultimately a lot of that is important to the commercial aspect of any medical device company, is to get reimbursement. And how do you increase your coverage, or how do you get access to alternative or different indications of use than what you're approved for? So those are some of the opportunities, and by connecting your devices or collecting data, you can unleash. Also efficiency. As any company, you can use data to be more efficient in your resource management, efficient in your contractual obligations, and we'll look at some of the examples shortly. And then in general, getting competitive edge. So, today's world is connected. People have their phones on them all the time. They expect things to be connected. So there's the expectation management you need. You can also use data and connectivity to use a different kind of business models that may also give you competitive edge over your competition. So we'll look at those opportunities in detail. So looking at reduced healthcare costs, the first kind of opportunity is around patient monitoring. So patient monitoring is important because you can, if you monitor patients, specifically patients when they're discharged from hospitals, there's a big enough readmission rate. So if you can reduce the readmission by knowing when a patient falls off the of the therapy or of their prescribed regimen, you can basically intervene and reduce that readmission rates. It's important for two reasons. One is it's good thing to have less readmissions because it reduces healthcare costs, but also from the way the healthcare policy is growing in the last 10 or so years, is there's emphasis on kind of complete value or outcome-based care, right? So the outcome-based care means that it's not just you treat someone, but that you actually cure someone or provide a outcome that is beneficial to them. And readmissions, specifically in a short period of time, are considered very bad. So hospitals are being given a kind of a mandate to reduce that, and there is a lot of funding tied to reducing readmissions. So there's opportunity in creating services or creating solutions that will allow these hospitals or doctors to kind of monitor those patients, right? Monitors their vitals, monitor their therapy regimens, monitor kind of anything that may be useful, and making sure that you can intervene early on. So those are kind of the solutions a lot of market is looking for, especially hospitals are looking for, and those are something that requires or necessitates connectivity, in the sense that you collect data on these patients. You may collect that data centrally, and you may be able to kind of predict or analyze that data and kind of provide a complete patient monitoring system to the hospitals. Early diagnosis, another big field. A lot of our costs are because diseases are not caught early on, specifically on chronic disease or cancer in general. A lot of research says that if you find some of these disease states early on, not only is your cost lowered, but also your outcomes improve. There's a much better chance of survival if certain diseases are caught early on. So early diagnosis is a key. Today, the problem with early diagnosis is just not always easy to know when things are going, because doctors only have limited time and limited capacity to understand data. But that's where computer-based diagnostic system can help, right? So that's what a lot of the emphasis today in the AI, ML, artificial intelligence, machine learning world is to find, or as early as possible, risk factors in terms of either look at images or scan images of CT scans or X-rays and find maybe that lump or maybe that problem that may be growing into cancer, or find risk factors from a patient through genetic testing. So a lot of early diagnosis efforts are being pushed, and that's something that is still not a market that's not saturated. There's a lot of opportunity around that. Again, this requires access to data. This requires the ability to collect everything and do analysis around that. So that's a big opportunity to reduce the healthcare cost. Patient compliance. So you get the patient, you find the diagnosis early on, you provide them with the therapy, but a lot of patients just fall off. They don't take their drugs, they don't take their therapy. One example is a sleep apnea world. There's an estimate that about 50% of the patients, once they get the sleep apnea therapy, fall off. They stop using the machines. A lot of that has to do with because the machines are really, really bulky and really less user-friendly to use. But also a lot of that is just, there's not enough intervention, there's not enough understanding or not enough explanation of why certain things are needed. If you can track that, though, if you track the patient's compliance and you see that they are not using it anymore, you can intervene and you could potentially keep the patient on the therapy regimen and improve their outcomes and improve their lives. So again, patient compliance can reduce quite a bit of healthcare costs. And then the last is just better treatment decisions. A lot of times you find diagnosis, there's options or there are opportunities of different treatments to be applied, but there's not enough data on the outcomes of each one, especially personalized data. So the therapy that worked for someone, does it work for you? And what are the differences between the other person and you? What are the similarities? And why would a therapy A work better than therapy B on you? There's not enough data around that right now, so treatment decisions are made in a way from more on a comfort level of the doctors on what they're used to or what they believe will work, but it's not very personalized. It's more broad and it's more depending on the exposure the doctor has had in terms of what they treat. So again, collecting a lot of this data, getting more personalized can help get better treatment decisions and avoid having to pay either from insurance or yourself a lot of cost on treatments that don't necessarily give you better outcomes. So that's kind of one opportunity is, providing services or solutions around reducing healthcare costs. The second one is around delivery models. Delivery, again, as I said before, is very, very, the classical system is you go to a healthcare clinic and they do things on you, they test for you, they provide you healthcare, and it's very, very burdensome process. It takes time. It's burdensome on the patients, also burdensome on the healthcare facilities, and it's not necessarily the most efficient system. So can you create a different delivery model? And one example is diagnostic kits. So diagnosis kits or testing kits are generally something that a lab would do. So you go to a lab, you provide a blood work, you provide a urine sample or your genetic samples, and they will do some test on it and provide you the results in a few days. And it was a longer process. But the ability to kind of commoditize that kind of kits and provide so that a person in the home, their own time and their own schedule, can take these tests and provide, and that can create a diagnosis that may be shared with their healthcare person is something that is slowly but surely coming onto the market. One good example is a company from California called Scanadu that created a urine analysis. It would basically identify pretty much all the standard urine tests that you do in your annual visits, but in your comfort of your home. You take a urine, there's a strip that you dip, and then you take your phone and you take a picture of that strip, and it uploads those pictures into its centralized servers, does some image analysis, and within 5 minutes tells you basically your glucose level, your bilirubin levels, and pretty much all the standard metrics that you have in your urine test. And everything is done within home, and you can share that information with your healthcare personnel. So again, you avoided the whole process of going to a lab and waiting for 3-4 days to get that results. And it's basically cheap enough where that you can directly sell it to consumers. So instead of going through the whole insurance problem, you just avoided a hassle in terms of approval, in terms of paperwork, by going this route straight to the consumer. So that's one opportunity that a lot of the companies we know of are developing in that arena. Another one is digital apps. So this is more on completely different delivery model. Instead of an actual person delivering a healthcare advice or service, it's the apps doing that. Great. They have some great success in the mental health arena, where with the rise of PTSD and depression in general, a lot of these deliver kind of similar healthcare outcomes that a normal psychiatrist would do, but it's much easier and much cheaper to deliver. So completely different delivery model that wasn't necessarily something people thought of about 5-7 years ago, but has worked. And then telehealth, which is again something that's increasing as more and more restrictions are being lifted. We just saw a policy bill passed like a couple of years ago in Texas, and this is something that's happening all over the country. But telehealth is becoming more and more accessible and much more friendly to the patient in terms of scheduling, but also much more cost effective. And you get pretty much the same services. But again, it requires infrastructure, requires that connectivity, requires you to be able to transmit information from the patient to the doctors and doctors to the patient. All that can be achieved with cloud connectivity. Third one I want to talk about is just improving reimbursements. So insurance coverage is essential for any medical device company. I know the first question most people ask is who pays, and generally it's insurance or Medicare, private insurance or government insurance, but it's something that's covered. And unless you have the coverage, your chance of being a successful medical device company, at least in the current arena, is hard. So how do you get better coverage, or how do you get coverage to begin with? A lot of that is around data. So if you can prove to an insurance company that your therapy or your device or your diagnosis or whatever your device is, or whatever the intention is of the device is better than what's available in the market. So either cheaper or it's better outcomes, then you get better coverage. So again, connecting all the data is very important to prove to the insurance company. One example is the Medtronic, what they call the smart glucose monitoring. It monitors for your glucose, and then it's a closed loop system. So not only monitors for glucose, it actually provides insulin when needed, with some overrides and stuff. But they basically collect that data to prove that their system was better. And this was real world data. So as patients were using it, the system was better in covering or managing complexities that may arise or complications that may arise on people not managing the insulin. So over I think it was 2-year study that they found that the patients that were using their systems overall had a much lower complications from insulin management. That got them better coverage. Not only that got them better coverage, but that actually made some of the, I think it was Aetna that actually came on board as a partner. And covered a lot of that cost. So again, by collecting that data, they could prove that they are better, and that led to better insurance coverage. The other part that is still in kind of pilot study, but it's a system or it's a program from the FDA. It's called NEST. I think it stands for National Evaluation System for Health Technology. But one of the things they're doing is there's this whole emphasis on what's called real world data. So traditionally, again, the way stuff works is, to get approval or something, you design the system, you follow all the regulations, all the requirements, then you test that system in a clinical trial or a very controlled environment. You take that data and you go to the FDA and you say, well, look at the data and works, and then you go through that. Problem is, clinical trials are very expensive, specifically if you have some high risk devices. So getting that data can be cumbersome. However, the NEST program the aim of the NEST program is that you to collect real world data while somebody's using your devices for a different indication. And as you collect that data, if you can prove through that data that you may have other indications that may be that is data that indicates your device is useful for other things, that the FDA would be willing to look at that and approve your device for additional indications of use without having to go through the normal kind of the clinical model. So that's kind of huge if you already have a device in market, and you have potential expanded indications of use. It's just purely as collecting data and proving to the FDA that it works without going through a lot of cost that comes with that. We had a company here in Houston that the device was basically a dental device to manage or control your the lifetime or the total time it takes for braces. And they found that there's some additional indications of use around pain management. And if they can prove that by collecting data, they get additional approvals without having to go through any of the hassle of getting the clinical trials conducted. So there's again opportunity in connecting and collecting data. The last one I was talking about is efficiency in general. As a company, any company, you want to be efficient. You want to be able to deploy your resources in a very cost-effective way and still provide quality care or quality devices. Some of the things you want to do is detect device failure. Specifically, your devices are, if they're life-sustaining or life-extending devices, you don't want them to fail because their failure creates a lot of problems for your devices. So you want to detect that device failure upfront. So again, how do you do that? By connecting and by collecting data and processing data and pretty much creating something similar to a check engine light for your devices that you have on your cars, but we don't generally put those kind of things on devices. Better maintenance. So again, if your devices are such that you are responsible for maintenance, specifically if you're selling into hospitals and you have maintenance contracts, a lot of maintenance today happens based on statistical models. So you look at a lifetime of device and you say, okay, this on average requires maintenance every 7 months or every 6 months. And that's how maintenance workforce are deployed. But a lot of that is also dependent on how the usage is, right? So if you use it more, you probably need more maintenance. If you don't use it more, you may or may not need as much maintenance. So again, by knowing the usage patterns or collecting that information, you may be able to better deploy the maintenance workforce instead of always making people go on a fixed schedule. And the last is just access to field data. You have a complaint in the field. Sometimes getting to the data that created the complaint, that can take a month. We have experience with some devices where it takes a month or two to find the right person and download that data from the devices and be able to analyze it. It's a lot of lost time that may lead to a lot of other adverse events. You want access to field data almost immediately, so that your complaints and your CAPAs can be resolved in a timely manner and that you avoid any potential additional complications with those. So access to field data, again, can create a lot of efficiency in your system. And then competitive edge, as I said, you want to be competitive because there's a lot of options out there. By collecting data, you can use that data to improve your products. You can see usage patterns. You can see what people are liking, what they're not liking. You can see, in some ways, also additional use cases or additional improvements that can be made. You can look at new business models. So by connecting, the traditional business model, for example, right now is to sell. So you build hardware, you build your devices, and you sell. You sell directly to consumer, you sell to health systems, but you're selling. Maybe there's a more service-based business model where it's more, you have the hardware, you lease the hardware, and then you sell services on top of that hardware. That may be more lucrative in long term, but also allow hospitals to manage their budgets more wisely, and so make you more competitive than the traditional model. So again, collecting that information and using that to provide services can be very useful. And then last, as I said, managing expectations. People are connected. They expect things to be connected. We just talked to a colleague of ours who uses a sleep apnea machine, and basically the machine doesn't connect, so he always forgets. His doctors there's basically a SD card that he has to take it to the doctor every 6 months, and he forgets. And it's very frustrating because it's like, why can't you just talk to my doctor? Why can't I just tell what I'm doing? And those are kind of managing expectations around, specifically as more and more younger people, they grow up and they're always being connected. That's their default assumption. So not having connected devices or not having solutions around that can be a problem in the competition. So as we talked about all these opportunities, obviously connectivity brings a lot of challenges. So nothing is free, and there's stuff to be thought about. The biggest challenge, obviously, is security and privacy. We hear that every day. In fact, I just read an article this morning around Medtronic's, I think it was a heart valve system that had some potential cybersecurity risks. We had the St. Jude system last year that was in the news, and security and privacy across all industries is a problem. But with healthcare, because the healthcare data is so important, and because the potential of devices to affect someone's life, the security and privacy is of utmost important. So that's a big challenge you have to solve the moment you connect your device to the internet. Expertise. So traditionally, medical device companies are more hardware focused. Software, if you have software teams, again, they're focused on more care delivery and not necessarily the IT part of it. So acquiring that expertise is a challenge, and obviously cost. So if you have to figure out, how to monetize on that connectivity and how to basically use connectivity as a growth of your company. So, but there is a cost associated with it, so that has to be accounted for. Some of the challenges of talk is active attacks in terms of security and privacy. So cyber attacks that are actively trying to attack your devices or your stuff, or malwares where you are more of something just came out because you were on the same network or they were connected onto something that was infected. Data theft. So the other part is not just cyber attacks, but data is important. Data is important for everybody, but healthcare data is even more important. It has the same value, if not more, than financial data. And as you see in the news in the last couple of days, the cost of a financial data theft and the healthcare data theft cost is essentially the same, if not more. And then accidental disclosure. So when you have data, so one thing is for bad actors to come and take data. But a lot of time, just because I have data, I may talk about it, but I might leave my computer on and somebody may see it. So the accidental disclosure is also a problem if you have data on your data accessible to you. And then improper access controls as people move in the company. So you have the system, you have everything in place, people have the right access, but as they change jobs or they move roles, not changing those access controls can be as problematic in terms of accidental disclosures. So those are challenges you have to deal with in terms of security and privacy. And then cost and expertise, being a medical device, being a regulated industry, there's a lot of expectations in terms of software. Even if it's only for data storage, there's still HIPAA and there's still privacy requirements. So start with technical requirements. As I said, you have to understand all these stuff, all the IT stuff, how to do cloud programming, how to design systems, how to use the cloud infrastructure that is available to us. Regular requirements in terms of design controls. If you're in US, FDA design controls. If you go international, whatever jurisdictions you have to deal with. Industry standards, security requirements in terms of just making sure everything works. And there's a lot of kind of both industry requirements and in some cases government recommendations around that. And then privacy, as I said, HIPAA, HITECH, and then in EU is the GDPR that has a lot of requirements on terms of how to protect privacy of users and punishments if you don't do that. So, and then integrations, like a lot of this data eventually needs to end up in some kind of electronic health system. So, because doctors don't want to go through 20 different portals, 20 different systems to look at different kinds of data. They want all integrated in general place as electronic health records. So integrations around that. So there's a lot of cost and expertise around that. And obviously, people need help, right? So that's what we do. The question is, can these risks be managed? And the answer is absolutely. But there's work to be done to do those kind of risks. So where to start? The first thing is to understand requirements and risk profile, right? So risks, if you're only collecting data and storing them, is much lower versus if you're doing analysis of that data and you're providing active, control of the device. So different risk profiles on your device or use cases may require different controls that you need to put into the systems. Some of the key points to consider is kind of what data needs to be collected. That's important. How is that data going to be processed? And then how is it going to present it to stakeholders? Because there's risk in misunderstanding data. There's also risk in people not using it because it's too complicated. And then how is the device being secure in terms of how do I not allow other people to control the devices? But also the data itself, how do I keep the data secure on the device? And then if I'm transmitting, how do I transmit that data in a secure manner to a centralized cloud system? And then how is the cloud itself being secure? What are the controls there? So all those are things you have to kind of think through when creating a kind of a digital health solution. And then access controls, who gets access to what? How do you limit the access? And how you train your people so that accidental disclosures don't happen as much, and that they're not just clicking links and putting passwords that says password, stuff like that. And then just, how are you complying with all the regulatory and privacy requirements, and then what are the risks of non-compliance around that. So next step, once you kind of figure out all these information, is, designing the system, which itself takes quite a bit of time. In our experience, somewhere between 6 to 9 months, but that's something you do. You have to understand the data profile, you understand what data is being collected, what to do with that data, how to store that data, how to process it, and how to present that data or information that is created from that data to your stakeholders. And then securing devices. So again, what are measures that need to be directly on the device? What measures are needed to be in the cloud? And what measures are needed to be kind of doing transmissions? And then how do you protect against threats? So, kind of active monitoring. How do you actively monitor? What are the tools you use to understand what's been happening to your system? How do you apply security patches because a lot of this is going to be developed on third-party systems that somebody else's operating system, somebody else's libraries. How do you constantly know that their security patches are being released, and how do you apply them in a way that does not interfere with your delivery of your care or your therapy or whatever is the device function? And then managing privacy so there's quite big penalties in not managing privacy of data these days. So managing access controls, and how do you change that over time? And then managing deployment, specifically if you're going international, there are requirements on where data can reside, where data has to transmit through. Different jurisdictions have different requirements. So you have to understand those and address those concerns. Uptimes. So obviously, if you're going to have connected health, you need to be working all the time. So that means managing your IT deployment in a way that you don't have a downtime, and then your performance of that system is acceptable. Obviously, data comes with other requirements, and backing up that data, and then if disaster does happen, a plan and a way to recover all that function. And then training users, training your employees, training maybe the end users on usage of the system. So that does add a cost. And then post-market surveillance programs. So just like we do post-market surveillance for complaints or other clinical problems, similar program has to be established for security monitoring, knowing what security risks you have, what are the patches that you need to deploy, how to deploy them, all that stuff. As I said, we talked about all that stuff. So how can we help? This is my shameful plug. But we are a cloud platform that is purpose-built for medical devices, and we take on the onus of a lot of stuff what we talked about in terms of management of the cloud and management of the security and the data. We provide quick integration, so you're not developing the whole solution by yourself, which may be lengthy and cost prohibitive in some cases. We provide flexible data workflows so that it meets your needs in terms of how data is being flown, how it's presented, how it's deployed. We provide web portals so that you have some user interface to be able to view the data across multiple platforms, and for multiple stakeholders, whether it be physicians, whether it be patients or the families or the manufacturers or your partners. Data visualization in very different ways, so you can kind of understand the trends and issues within your systems. Access control engine to always understand what the accesses are and how to quickly change them. Global compliance, so our systems comply with FDA, they comply with the EU requirements, Health Canada, and so we basically comply with pretty much a large swath of the world healthcare market, and we're adding more and more compliance with other jurisdictions. And then we are fully managed, so we do all the operations, we take care of all the deployment, we manage everything, security, accessibility, data backups, and all that stuff. So all the IT work we do, and we are priced to grow, so we can work with small startups up to big companies. So we're not necessarily $1 million solutions that is price prohibitive, only a few $1,000s a month, and you're good to go. But in conclusion, connected health is here to stay. That's not going away anytime soon. There are risks in terms of security, privacy, and cost, but the benefits in terms of greater conveniences for the physicians, for the patients, better adherence, improved insights that bring with data collection that can improve your products or give you a competitive edge. And overall, I think the most important thing is better health outcomes, right? If you have better health outcomes, your device or your therapy or your diagnosis is going to be more in demand, and that's a great thing to have. So that's the conclusion. Any questions I will take at this point. Thanks for listening.
Yeah, thank you so much. And I haven't seen any questions come through online, and I see lots of wheels turning here on our end. So if anyone's going back through the presentation and does end up having questions, his contact information thankfully is included right here on the slide. And like I said, this presentation is recorded, so it'll be up on our YouTube channel. And also, if you'd like a copy of the presentation, you can reach out to either us or Abbas, and we can get you that as well. But I don't see any questions yet. I'm sure you might have some come through after this via email, but thank you so much for your time today. And this was packed with great information, so we really appreciate you coming on.
Thank you, and thanks for your time. Thank everyone.
Perfect. Thank you so much. Have a good rest of your day.
Hey, bye.